That morning call to the GP is incredibly stressful. Repeated calls, sometimes engaged if they don't have the right telephone system, but repeated calls, sometimes day after day, failing to get an appointment. That adds to the pressure, the strain, the anxiety that people already feel because they believe they've got an important illness that needs to be addressed. But those long waits are adding to the problem, let alone the fact that something might be really urgent and they don't know it. And therefore that might prevent us from dealing with the early intervention that GPs often provide. Ivan McKee was bang on when he was talking about GPs being the gateway, the preventative service. The old-style family doctor was really important as part of the community. Now, I know it's changed, and I'm sure everybody recognises that now the additional health professionals that are part of that multidisciplinary team that the Minister's just talked about. But Paul Gray, the man who used to be in charge of the NHS in Scotland, did give the government a warning some time ago that irrespective of the pandemic, irrespective of Brexit, there were already deep-seated problems in the NHS. And I'm afraid the response from the government has been wholly inadequate. They're not on track, according to the RCGP, on the recruitment of GPs. They're just not. The last 2 years, there's been a decline. In mental health staff, we're not, according to Audit Scotland, on track to meet that either. They say the plan is at risk. The multidisciplinary teams, I've raised this before with the Minister, there are pockets of the country where we're not able to recruit members of the multidisciplinary team. There has been a cut in year budget on the mental health. That doesn't help either. So we do need action.